Please subscribe our channel. Press bell icon to get continuous updates. Thank you. Symptoms appear and disappear rapidly. Option A, stanomet. Option B, platinomet. Option C, petroleum. Option D, all of the above. Answer option C, petroleum. Pain as if scraped with a knife. Option A, phosphorus. Option B, phosphoric acid. Option C, both A and B. Option D, none of these. Answer option B, phosphoric acid. Sensation of growing larger in every direction. Option A, calcarea carb. Option B, platinomet. Option C, petroleum. Option D, none of these. Answer option B, platinomet. Suppressed menses in young girls. Option A, pulsatilla. Option B, podophyllum. Option C, both A and B. And option D, none of these. Answer option C, both A and B, that is pulsatilla and podophyllum. Unable to breathe well is chilly in warm room. Option A, bryonia. Option B, pulsatilla. Option C, rustox. Option D, tuberculinum. Answer option B, pulsatilla. Coldness of vertex with headache. Option A, calcarea carb. Option B, sepia. Option C, graphitis. And option D, sulphur. Answer option B, sepia. A single dose often act curatively for many weeks. Option A, calcarea carb. Option B, sepia. Option C, pulsatilla. And option D, sulphur. Answer option B, sepia. Extreme exhaustion of mind. Option A, natremure. Option B, stanomet. And option C, pulsatilla. Option D, sulphur. Answer option B, stanomet. Awakens with a stringing look, as if afraid of the first object seen. Option A, belladonna. Option B, stramonium. Option C, spigelia. And option D, all of the above. Answer option B, stramonium. In fever, ravenous hunger for days before attack. Option A, sorinum. Option B, staphysagria. And option C, tuberculinum. Option D, sulphur. Answer option B, staphysagria. Feels unusually well day before attack. Option A, sorinum. Option B, staphysagria. Option C, tuberculinum. And option D, sulphur. Answer option A, sorinum. Vomiting as soon as he raises head from pillow. Option A, rustox. Option B, coculus. Option C, stramonium. And option D, epicac. Answer option C, stramonium. Is recommended as a prophylatic in malarial and African fevers. Option A, cinchona. Option B, terebinthine. And option C, pteridine. Option D, tabacum. Answer option B, terebinthine. Can only void urine while sitting bent backwards. Option A, staphysagria. Option B, cingum metallicum. Option C, sorinum. And option D, medorinum. Answer option B, cingum metallicum. Child kicks off clothing even in coldest weather. Option A, Hepar sulph. Option B, sulphur. Option C, Sanicula. Option D, all of the above. Answer option D, all of the above. After belladonna, fails in scarlatina. Option A, stramonium. Option B, sanguinaria. Option C, rustox. Option D, all of the above. Answer option B, sanguinaria. Miscarriages, especially at third month. Option A, sepia. Option B, sabina. Option C, both A and B. Option D, none of these. Answer option B, sabina. Vertigo, when moving slowly, but not when taking violent exercise. Option A, sepia. Option B, millefolium. Option C, tabacum. And option D, silicea. Answer option B, millefolium. Nocturnal emissions, stained with blood. Option A, ledum. Option B, mercurius. And option C, sarsaparilla. And option D, all of the above. Answer option D, all of the above. Often curative after Eugenia jambosa in acne. Option A, calicurb. Option B, calibromatum. Option C, calimure. Option D, calibicromium. Answer option B, calibromatum. Elective affinity of remedies. Epis, cellular tissues. Argentum metallicum, articulations, bones, cartilages and ligaments. Belladonna, throat. Bryonia, serous membrane. Cimicifuga, cerebrospinal and muscular system. Also uterus and ovaries. Cratagus, acts on muscles of heart. No influence on endocardium. Echinacea angustifolia, vermiform appendix. L. serum, kidney. Hecla lava, tumor in antrum of Hymor. Epicac, pneumogastric nerve. Muriatic acidum, blood, mucus outlet of bodies, mouth and anus. Phosphorus, nervous system. Rustox, fibrous tissues. Rota, periosteum and cartilages. Sepia, portal system. Analog medicines. Chemical analog of allium cepa is phosphorus. China, ferromate. Dulcamara, calisulph. Epicac, cupramate. Podophyllum, plumbamate. Pulsatilla, calimure. Phytolacca, caliad. Bryonia, alumina. Aloes, sulphur. Belladonna, calcarea carp. Mesotherium, Maxol. Bowel nosotes. Bacillus morgan pure is sulphur. Morgan Gardner, Lycopodium. Bacillus proteus, natramure. Bacillus mutable is pulsatilla. Bacillus number 7, iodum and calicarb. Bacillus Gardner, phosphorus and silicea. Bacillus faecalis is sepia. Cough abates after eating or drinking warm things. Option A, scula. Option B, spigelia. Option C, spongia. Option D, sternum metallicum. Answer option C, spongia. Loose pappy offensive stool in children. Option A, borax. Option B, rheum. Option C, jatropha. Option D. Croton-Dick. Answer option A. Borax. Hysterical amblyopia. Option A. Cyclamen. Option B. Onosmodium. Option C. Rota. Option D. Gelsemium. Answer option D. Gelsemium. Most important part of prescription. Option A. Superscription. Option B. Inscription. Option C. Subscription. Option D. Signature. Answer option B. Inscription. Name the carpal bone which ossify last. Option A. Lunate. Option B. Pisiform. Option C. Capitate. Option D. Hamate. Answer option B. Pisiform. After hemorrhage from piles, prostration out of all proportion to amount of blood lost. Option A. Hemamelis. Option B. Muriatic acid. Option C. Millefolium. Option D. Collinsonia. Answer option A. Hemamelis. Truncan gait is seen in option A. Cerebellar lesion. Option B. Parkinson's disease. Option C. Posterior column lesion. Option D. Spastic paraparesis. Answer option A. Cerebellar lesion. NS1 antigen is diagnostic for which disease? Option A. Chikungunya. Option B. SARS disease. Option C. Dengue fever. Option D. Yellow fever. Answer option C. Dengue fever. Skin feel cold to touch, yet the patient cannot tolerate covering. Option A. Carbovec. Option B. Cecal cord. Option C. Lachesis. Option D. Cinchona. Answer option B. Cecal cord. Maternal alpha-feto protein is increased in option A. Fetal cardiac defect. Option B. Diabetes mellitus. Option C. Neural tube defect of fetus. Option D. Hypertension. Answer option C. Neural tube defect of fetus. Anthrax belongs to which chapter in Kent repertory? Option A. Skin. Option B. Head. Option C. Extremities. Option D. Abdomen. Answer option C. Extremities. More striking, singular, uncommon and peculiar symptoms are called option A. Primary symptom. Option B. Secondary symptom. Option C. Characteristic symptom. Option D. Auxiliary symptom. Answer option C. Characteristic symptom. Remedy for contraction of hamstring tendons. Option A. Causticum. Option B. Medorinum. Option C. Ammonium muriaticum. Option D. Cuprum metallicum. Answer option C. Ammonium muriaticum. Diabetes mellitus in which chapter of Kent repertory? Option A. Generals. Option B. Urine. Option C. Abdomen. Option D. Stomach. Answer option B. Urine. Toothache better by mouth open and drawing in air. Option A. Cophia. Option B. Creosotum. Option C. Mercurius. Option D. Meserium. Answer option D. Meserium. Which is general order of subrubrics in Kent repertory? Option A. Time, modalities, side and extension. Option B. Side, time, modalities and extension. Option C. Modalities, time, side and extension. Option D. Side, extension, time and modalities. Answer option B. Side, time, modalities and extension. Disease of such a kind which attacks several persons at the same time here and there called option A epidemic, option B endemic, option C sporadic, and option D pandemic. Answer option C sporadic. In which aphorism Hahnemann describes about homeopathy specific remedy? Option A aphorism 154, option B aphorism 151, option C aphorism 162, option D aphorism 172. Answer option A aphorism 154. Complementary to soranum is option A sulphur only, option B tuberculinum only, option C both sulphur and tuberculinum, option D neither sulphur nor tuberculinum. Answer option C both sulphur and tuberculinum. Obstinate constipation for years. Option A syphilinum, option B sulphur, option C soranum, and option D aluminum. Answer option A syphilinum. Please subscribe our channel. Press bell icon to get continuous updates. Thank you.